This is Dr. Louis Eichel. His microphone works because that's how you were hearing me. He's the chief of Rochester General's Division of Urology, talking about Prostate Cancer Awareness Month. We were just talking about what's new. Where do we stand on this? We've gone back and forth on, I know, PSA tests and other things like that. What's the best knowledge right now about preventing prostate cancer or detecting it?
Actually, I think the biggest thing in the news right now is a study recently came out showing that since the U.S. Preventative Task Force recommended against screening men for prostate cancer, there's been a 28% decline in the number of cases per year diagnosed in the United States. And that's across the board. So 28% fewer cases of low-risk prostate cancer, but also 28% fewer cases of high risk and intermediate risk prostate cancer. So while you may avoid overdiagnosing some men with low risk cancer, and those men may not need treatment, you're also missing a significant number of cancers that could be potentially lethal.
So what is the thought then on screening for prostate cancer? I mean, men are screened starting at a certain age.
Well, most cancer organizations and the American Urologic Association recommend having an informed decision-making discussion with your physician and starting to screen depending on your risk factors at an age of 50, 55 years old. There are some men with a family history of prostate cancer, or African Americans are actually at higher risk of prostate cancer and more aggressive prostate cancer. And men in those groups should probably be screened at an even earlier age. But most professional medical organizations do recommend having an informed discussion with your doctor. And if you want to be proactive about your health care, which most doctors do recommend, it's a good thing to be screened. And then, if you are to be at risk, you're counseled appropriately for it.
Do you still run into men who maybe even avoid a physical, an annual physical, because of the prostate exam, and it's just something that, my goodness, it's over in 10 seconds,
Absolutely. I mean, prostate cancer affects 1 in 5 to 1 in 6 men in the United States in their lifetime, so this is a gigantic men's health issue. In Monroe County, there are about 650 new cases of prostate cancer found every year. So it's a huge male health issue, and there is a little bit of a barrier in getting men to be screened because they're basically scared of a digital rectal exam, which, like you said, takes a matter of seconds.
Yeah. And where do we stand on the PSA test, which is a blood test? Where do we stand on that? I remember in the news a few years ago thinking, well, it's not really effective, but I know that my doctor still does it. Where do we stand on that?
Well, basically, the PSA test, PSA is a chemical that's made by your prostate, and it's only made by the prostate. And when it's elevated, it could be a sign of cancer, but it can also be a sign of prostate enlargement or inflammation of the prostate. So it can be a somewhat confusing test. As long as it's interpreted properly and trends of PSA are followed over time, it's much more meaningful than just one test one time. So it's a good reason to get started early and then following a trend.
We've got 30 seconds left. What's the main message you want to get out during the month of September?
The main message is I feel it's important to be proactive, for men to be proactive about staying healthy. And I think there's a benefit to PSA screening when it's interpreted properly by a qualified healthcare professional. So I would encourage men to get out there and get tested.
All right. Dr. Eichel, thanks so much for being with us.
Thank you so much.